Good night, Diana. Can you hear me? Hello, Diana.
Hi, Miss. How are you?
Hi, everything okay? How was your day? Everything fine?
Yes, I'm a little bit tired, but yes, everything's fine. I got the flu, so I'm kind of sleepy.
Okay, got it. It's a busy day, I think.
How about you?
Okay. Well, can you watch my screen now?
Yes.
Okay, great. Yesterday we were talking about basic investigations, right?
Yes.
And according to that, today we can talk a little bit about vital signs. And I found this amazing page, I can say, this website. When you have different patterns about vital signs, you can exchange screens in order to practice a little bit how it works, right? How to make this report in a properly way in English, okay?
Oh, it's cool.
Okay, so according to your experience, can you read these slides? And if you find something that is not, well, that it's pathological, can you describe it, please? For practicing just.
Well, this looks like for the traits, it looks like a tachycardia, but I don't think so, because the heart rate it's normal. So
No. You have the heart rate, you have the parameter here, and now this value that is like a promedium, but it's not normal.
yeah, I know it's like a tachycardia.
Yeah. So let me see. Yesterday we got a specific expression that I think it's important to punctualize. The overall snapshot. Do you remember that?
No, I don't remember.
Okay. Yesterday we got a specific slide. When we got a paragraph with a reading, let's go to that page. This one. Here we can check this expression, overall snapshot, okay? Overall readings. I mean, readings that are showing us at the moment what is going on with the patient, right?
Yes.
Just at the moment. But following this, monitor these readings, this patient is having not a good time, I think.
No.
The blood pressure is
it's not that bad.
Yes, it's a good way to accept this, I can say, right? What about this one? Let's just change. Let's let this upload properly. Yes, what about these readings? What do you think about them? Again, a pathological one, right?
Yeah,
an atrial fibrillation. Yes, an atrial fibrillation, right?
Atrial fibrillation, yeah.
This patient is in trouble.
Yes.
And also how you could describe the values. Focus on the values and make me a description of this. Let's practice, because we are going to work on this kind of reports during this module 2. It's better to start talking about it, okay?
Yes. Okay, we have 103 heart rate, and the blood pressure is 132/87, and saturation, I want to say, I don't remember how to say that, is 93.
Okay, the oxygen saturation.
Oxygen saturation, yes.
Yes, considering that the patient is in your country, how you could start to control this? This patient, of course, is, for example, in an emergency unit. You place the monitor. But I'm sorry, where are you from? I forgot this detail.
Honduras.
Okay, in Honduras, you're at sea level, right?
Yes.
If you catch this oxygen saturation, what do you do with this patient, 93?
Nasal straws, puntas nasales. I don't remember how to say that.
With the cannula, right? You start
cannula,
the oxygen supply with the cannula, right? The facial cannula.
Oxygen supply, yeah.
Great. In that way, if you improve this, what would happen with the rest of the values? Just for practicing, don't worry, it's not medical evaluation, don't worry about it.
If I have luck, the rest is going to be gradually getting better.
Great. What about this? What do you do with this? Do you remember the treatment about an atrial fibrillation?
No, I don't.
Okay. With this treatment, well, you only control, you can use, let me remember this, nimodipino, I think, I'm not sure at this point, but you have to be so careful with this and the VP, because VP can fall down suddenly. It's a very common complication, right? Let's go with this new one. What about these readings? What do you think about them? This patient is really in trouble, right?
Yes.
A ventricle fibrillation, a B5.
A B5, yeah.
And the oxygen saturation is not possible to evaluate because if you got this rhythm, what's going on with your patient? The patient is almost getting into a heart attack.
Yes.
And following that heart attack, he can get into a cardiac arrest. And maybe the patient died. Yeah, it happens.
Yes.
Once I got a patient with a similar reading, and he came unconscious. Of course, another ambulance was bringing him to my hospital. And we ran mad when we got this electrocardiogram. We said, Rod, call the intensivist now, prepare a bed, we have to start now. It was so a terrible situation, and that patient actually died because there was too much time with this situation, and well, it was not easy to take in control the situation, right?
Yes.
BP, well, non-important, not as a fact at the point, okay? What about, let's make it open, okay, what about this one? Readings are not so clear, but, well, I lost them.
That looks like a bradycardia.
Okay, this one. This video. What would you say about it? This overall snapshot is showing us a very terrible situation, right?
Yes, that's like I want to say I don't know how to say it in English because my brain is kind of tired, but it's like actividad eléctrica sin pulso, ¿no?
Yes, could be a non-electrical activity. Could be.
Yeah, non-electrical.
Yes, okay. Could be a non-electrical activity. Okay.
Yeah.
It works. It could be. With medication, these values are acceptable, but just medication, not the real patient, right?
Yes.
Let's check this one. What about these readings? As you can see, the values are changing, right? The overall snapshot that we are checking now is changing all the time.
Yes.
We have the chance to evaluate the patient properly, having the correct evaluation continuously with the monitor. But when we don't have this, because we know we are from poor countries, and it's not easy to find this kind of devices in all places, well, we have to cross fingers. Yeah. And stay with the patient controlling. Imagine which situation could be, right?
Yes.
That's why this expression, overall snapshot, the general view with these values is important to understand as in the correct way it is shown. I mean, always looking the well-being, looking for this objective, and considering that this patient, well, according to the situation, may fail. We have to be clear on this, right? How you might express these values, how you can give
the overall
to their families.
The overall snapshot is that the patient is kind of
Imagine I'm the relative of this patient. Which information you would give me?
okay. The overall snapshot of your family is that he has a good heart rate. The blood pressure is a little bit high, but not something to be worried about. I don't see the oxygen saturation here, so I want to say that the patient is kind of stable, so we're going to have it an observation for a little bit.
Okay. Let's look for this one. Imagine, okay. It's not so clear. Well, values are possible to watch, right?
Yes.
Okay.
Well, the overall snapshot of your patient, of your family is good. He's stable, so his vitals are stable. He has a good heart rate. He has a good blood pressure. He has a good oxygen level, so he's going to be fine.
Okay, great. So it's possible to make it, right?
Yes.
The idea of this is practicing how to give these explanations. Do you remember the abbreviations of all of these vital signs?
How to write it or how to say it?
Tell me.
The BP, blood pressure.
Okay, okay, great.
HR is going to be heart rate.
Okay. Another way to talk about the heart rate, another abbreviation. I showed you yesterday 2 ways of talking about it.
I don't remember the other one.
The pulse.
Pulse, yeah, the pulse.
It's just the P, right?
P, yeah, P.
Okay.
And
then we got, you have 2 ways to talk about this. The SpO2 saturation levels. You can say oxygen saturation, like SpO2, like this, or
like
that. Yes, or just oxsat, okay? Similar to Spanish. Oxsat, oxygen saturation. Always with a percentage sign, okay?
Yes.
About the respiratory rate, you remember that?
R. I want to say that is the RR, so I don't know.
Yes, the double R,
sure.
perfect.
The double R.
And you have two abbreviations that are the same. I mean, it depends on the context. What do you certainly read when you catch the values and read all the information, right? The BPM, do you remember that?
The blood
Beats
pressure?
per minute? No. Beats per minute. When you talk about heart rate, the pulse,
right, yeah.
Or breaths per minute, according to the context you choose, which one is the meaning. Yes. You don't say, I'm talking about the heart rate, you don't say 21 respirations. No, it's wrong. You said breaths per minute, BPM.
Okay.
Right?
Yes.
Same, talking about the pulse, you don't say like this, 123 pulse. No, of course not. You say 130 beats per minute.
Beats, okay.
Yes, beats and breaths. That's the difference. And usually, in order they have the same abbreviation, we can get into confusion and make the wrong interpretation, we can say.
Okay.
It happens, but patience, patience.
Yeah, it's about the practice.
Yes, just with practice and following the values, of course, we can catch the idea. For example, if you got respiratory rate in 24, it's not going to be pulse, of course, right?
Yeah.
If you say 24, the patient is going into heart attack, cardiac arrest. So it's not possible.
Yes.
Yes, that's why. Tonight, I'm planning to send the notes how to prepare the physical exam about our patients, right?
Okay.
Do you remember we were practicing, we were talking about the case report. We got the first part of the medical history. Now we are going to work on this week on the physical exam.
Okay.
So I'm gonna send how to prepare this, and I'm gonna send dialogue again. And according to that dialogue, we have to prepare the case report and the physical exam. Okay.
Okay.
It's very easy to make in English. Always write down just the positive information, not all the information. It's not the way it works. If you write all the information, it's not the way to do it, okay?
Okay.
So you're going to check the notes, and it's possible, it's easy to make. No. Okay.
Okay.
Okay, that's all, my dear. That's the workshop I prepared for tonight.
Thank you, Mrs. Wood. It was great.
Thank you so much. Thank you for being on time. You are always following the schedule, and I really appreciate that.
Thank you.
Okay. See you tomorrow.
Have a good
okay?
night.
Have a good
See
night.
you.
Please keep on reading the slides from yesterday because they are almost the introduction for the presentation of tomorrow. Okay?
Okay.
Okay, great. So, see you, dear.
See you. Bye.
Bye-bye. Okay, today we are changing the workshop rule. And I sent the new role to the WhatsApp group during the afternoon. Let me see. Now should get into. Oh, you looked at it. Should get into the workshop. Pablo and Sarah, I think. Let me check it properly. Yes, Pablo and Sarah. Maybe because of the new schedule, Sarah is not attending. I'm gonna talk to her. I'm gonna send a message to her, and according to that, I'm gonna correct the situation. But Pablo was able to get into. So let's wait. Let's wait. It could happen. So I'll be back with my next students. Okay, let's wait a little bit more. Well, 8 and 23. Let's keep on waiting. They are not attending. I didn't receive any explanation about it. Patience, I'll be back. Good night, Elena. Can you hear me?
Yes, good evening, teacher.
Good night. How are you? How was your day?
Fine, teacher.
Great. So yesterday you were in class and I was checking the WhatsApp and you were with trouble at the beginning, right?
Yesterday, yes, I double number one, so that is why I couldn't get in or got in yesterday. Sorry.
Okay, don't worry about it. The fact is that you could get into the class and listen a little bit of this, right? Hi, Elena, can you hear me?
Yes.
Okay. Let me see. Yesterday, well, with you, let's make a review about the class, okay? In order to check that part of the class that you missed because you were not available to get into on time, right?
Yes.
Good night, Jimena. Okay, good night, good evening. Let's start with this, Elena. Yesterday we were talking about basic investigation. I mean basic meanings when we had the chance to evaluate the first steps when we collect information from patients. In your case, you both are professors, so these objectives are not following for medical purposes. The way we are going to work together with you both is giving explanation as if you were the interpreter of these situations from a patient. I mean, a patient gets in contact with you and asks for your translation from medical terms into common terms, okay? Hi, can you hear me?
Yes.
Okay, that's the way I think we can work. Trying to get the correct interpretation of the different situations that sometimes patients have with the doctor and really need a support, an extra explanation in easy words about the whole meanings we are talking about during the medical evaluation, right? That's why when we into medical terms say we as doctors say, so I'm going to ask for some investigation, some complementary tests, some complementary studies. Patients get scared and think that something is going extremely wrong, but it's not the case. We usually take these studies, lab tests, imaging tests, in order to make a control just, and in that way to catch if something is not going properly. For example, let's go with this. All of these procedures, blood pressure, taking pulse, taking the respiratory rate, even taking the temperature, blood oxygen, well, with all of these devices that are in the picture, if patients are elderly, they get scared and think that we are making these procedures because we have we are suspecting about something wrong, right? Let me see, Elena. Following your experience, how you might explain someone that it's important to make the blood pressure control.
Sorry, teacher.
For example, you are the interpreter of a lady, and that lady is scared because she went to my medical consultation and I need to take the blood pressure as a control, right? But my patient, that lady, feels scared about it. How you could tell her that this control is important at that moment? Give me that explanation, please.
In English, teacher?
Of course.
Well, okay. Well, first of all, I can say that don't worry about this. This is only a procedure that the doctor is going to take you. So, blood pressure, heart rate, pulse, respiratory rate, core temperature, and blood oxygen and ophthalmoscopy. Well, in this way, I can explain this. The
Okay.
patient.
Okay, you're explaining here that it's important to make it and it's not painful. Okay, we have to work on this. What about you, Jimena? How you would give this explanation to a patient about taking vital signs by a doctor, but the patient is scared? How you could explain this situation without scaring the patient, I mean?
Okay, so I will tell a typical solution to take to keep calm, and then as well that's it's something not strange. It's very normal when we have the blood pressure. Yeah, that's it.
Okay, great. That's the way we can start giving explanations, giving some ideas in easy vocabulary, translating the meanings. Because if I'm with a patient and the patient is with a relative or is with the interpreter, I would say prepare your relative, prepare the patient. I'm gonna take the vital signs. Explain him or her, explain the patient that there are non-invasive procedures. They don't hurt, they don't cause pain, but I certainly need all of these values to start my evaluation. Okay, that's great. Well, it's extra.
Okay.
Following, well, this chart specifically is talking about this specific expression, the overall snapshot, the well-being and data points. These ideas are showing us that vital signs at this moment are a value that show us how the patient is at this moment just. Maybe 1 hour all the values change, or maybe in a couple of hours, we don't know. They are so dynamic. The fact of making this evaluation and considering them just a snapshot at the moment is because we are looking for objective information to support the well-being of the patient, right? These data points are showing us that we must evaluate the patient as a whole, not just as a number, because always numbers are have the possibility to be wrong. We have to consider this, okay? About the stethoscope, well, it's just by memorizing all the parts of this because, well, it's important to take them in count. And the same with the sphygmomanometer, all the parts of this, right? For practicing. And let's go with this. How it works. This chart is so easy to catch how the sphygmomanometer works following the stethoscope and what we hear from this maneuver, from this procedure, and how it's easy to read. Okay, but let's see. Imagine you are with your relatives, with someone at the emergency room, and you are with doctor, and I as a doctor show you these readings. In these readings, the heart rate is so high. Okay, the BP, the blood pressure is under normal limits, it's okay. But we have all of these situations. The patient has a very complicated situation at this moment following these readings and has to be admitted at the hospital for treatment and control all the time. How you might explain to the patient that he has to stay into the hospital? What about you, Jimena? What would you say to the patient? Imagine it's your I don't know, one of your parents, for example, could be, or a very close friend, or someone that you trust on, or that the patient trusts on you so much, and is asking for what's going on, why should I get admitted? I don't understand anything, I just feel bad, please take me home. What you would tell to this patient? What is going on?
Everything is going to be well, good, sorry. And then, okay, the doctors may the procedure in a correct way.
Yeah. Okay.
Yeah, simple work. Okay.
Okay, could be. What about you, Elena? What would you say to your patient?
Well,
Yeah, to your patient, to your relative? Why? How you could give that information that the patient certainly needs to be admitted at the hospital and can't go home? Has to stay because there's no other way to do it.
Well, it's necessary to be at the hospital because you need to be controlled or something like that. I don't know what else. Okay,
Great, don't worry. First time it's not easy to give that kind of explanations, right? And it's very common when we give these explanations, patients or our relatives feel so scary because it's not a good point to stay at the hospital alone. But well, it happens, right? In that way, you could tell patients this explanation, maybe. We are here at the emergency room because you are not going okay. You have a severe trouble with your vital signs, and doctors decide that it's better to stay here. Patient is going to say, no, I feel great, I'm okay. But you certainly say, no, you are not okay. You need to stay here for taking control and for receiving treatment. That's all. That's the specific words. Receiving treatment, staying in control, or staying under control. And well, it's better. There are expressions that are easily to catch by patients. Okay.
Yes, teacher.
Okay, Elena, you feel the pull, right?
Not yet.
Yeah.
Jimena, did you feel the pull?
I did it. That's my first sign that I did.
Okay, great. Let me send it again, Elena, and then you feel it, okay?
Okay, please, teacher.
Okay, can you watch the pool, Elena?
Yes, I am doing it.
Great, perfect. Let's do this. This module 2, that's the way we are going to work. We are going to talk more about giving explanations, giving information. As with all of these ideas, we have to organize how it works, okay?
Okay, teacher.
So during, I decided to work with you as a couple because you both are professors and it's easy to exchange objectives when you are together, okay?
Okay, teacher. Thank
Okay,
you.
great. Please, for tomorrow, check the slides because yesterday was like an introduction for tomorrow class, okay?
Okay, teacher. Thank
Check the
you.
information, just to pass the view is going to be easier to catch the meanings while checking the first presentation, okay?
Okay, teacher. See you tomorrow.
Okay, Elena, see you.
See
Bye,
you
teacher.
tomorrow, Miss.
Bye, Elena. Bye, Jimena. See you tomorrow, you both. Good night, Dorian. How are you? Dorian, can you hear me?
Yes, you can. I just muted.
Okay, great. Now you are here with me. How are you? How was
Yeah.
the day?
Uh, uh, very normal, average, maybe.
Oh, lots of activities, I mean.
Uh,
You,
kind of.
okay. Well, patience. Now it's time to work on this. You are on second year, right?
Yeah.
Okay. But, well, yesterday we started checking the basic investigations, non-invasive procedures that we as doctors developed, right? This is a basis from the medical career, I think. And well, we have to talk a little bit about it. Is there a doubt about taking this information, maybe, about these procedures?
And not really, just not familiar with the specific material. I think the objects are normally used, but I understand most of the procedures. Just the optical one, I think I got a lot of problems with that. Just not really familiar.
Okay, with the ophthalmoscope, right?
Yep. Yeah.
Yes, we are going to use this device in, well, according to your university, in 4th or 5th year.
Yeah.
But this is just for information at this point because, well, here in Bolivia, I tell you by experience, here in La Paz, I worked in lots of hospitals. It's not a common device to find into the services. I got
Okay.
the opportunity to develop the fundoscopy in La Paz in 3 hospitals just. And of course, it's a necessary procedure to develop almost with all patients that are coming with trauma situations.
Okay.
Well, but it happens. We have to understand this.
Yeah.
Then what about this? About the stethoscope and the sphygmomanometer, now you got its
Yep.
parts in English. That's why
Yeah.
for checking, for catching more specific vocabulary, okay?
Okay. I
Okay.
got another question. Like, we gotta focus on not the material itself, but the procedure, right? How
Yes.
we're gonna proceed with the treatment and all that stuff. Now, that's not actually theoretical, but more practical.
Yes, these module 2 workshops
Okay.
are giving explanations. We are going to practice how to write down the physical exam and reading the complementary studies, okay?
Okay.
That's why it's more practical. You have to give me ideas into the medical thought, but considering you are on second year, of course, with you, it's going to be easier. I'm not going to evaluate you as a doctor, of course, because you certainly need the clinical basis for developing all of this information. So don't worry about it.
Okay.
Okay, Dorian, let me see. Following the information that I was giving yesterday, certainly good night, Laura. Thanks for attending.
Hi, teacher.
Hi. Following this information, Dorian, if I show you these readings, what can you tell me about it? Yes, what do you understand from this? Don't worry if you make mistakes. I'm not evaluating medical information, of course, just expressions, okay?
Okay.
Tell me, what do you understand from these readings?
Like the rhythm it's may vary. It's kind of I don't know how to describe it. I've seen this side of
Yes, it's varying a lot, right?
yeah.
But let me see. If you check these values, of course, they are going to change because the overall snapshot, as I was telling you, is so dynamic all the time, right?
Okay.
So
Yes.
the heart rhythm, the heartbeat, how you can describe it? Is high, it's tachycardia, it's, I don't know, it's a mess.
Cardio.
It's a mess, right?
Yeah.
Do you remember the abbreviation of this one?
The rhythm when it's higher than normal.
Yeah, you got this. Beats per minute, okay?
Okay.
BPM.
Yes.
What about the blood pressure? What do you think about it? It's under normal parameters, right? It's normal,
Yes.
right?
70, 120. Yeah.
Yes, it's according to under normal values at this point, following the guidelines. But Laura, you are a doctor now. Let me see. If you got this reading and this reading specifically, what do you think about?
Teacher, I'm going home right now, so I'm not listening very well. But for I can see, that looks like a supraventricular tachycardia.
Yes, that's great. This cardiac arrest rhythm, right?
Mm-hmm.
It's a
And
critical
it needs the defibrillator to start the sinusal rhythm again.
Yes, we have to help the patient to solve this, right? Let's go back. No, my readings. I'm not gonna lose them. I know. Oh, my internet is not so clear now. No, it's not. Okay, it could be. What about this one? Let's cross fingers and it opens. Okay, this one, the one that is getting a little bit bigger. Laura, can you watch it?
Yes, I can see it right now.
Okay. Tell me something about it, because all workshops are gonna be from like this, right? Talking to me. This one is checking the readings, the monitor readings, in order to practice how to develop this information.
The EKG you are signaling right now?
Yes, the one that I'm signaling, because I cannot open bigger. I'm sorry, it's failing my internet connection.
That looks like an atrial arrhythmia.
Yes, an atrial fibrillation, right?
Mm-hmm.
Okay, but it's with treatment, it's gonna work, right? Dorian, if you are with your patient and you receive the information that your relative has to stay into the hospital, how you could give this explanation? Which expression you might use to tell your relative that has to stay into the hospital? Dorian?
How would I describe its condition based on the electrocardiogram? Just to make it stay denied. Maybe, I don't know, patient will not understand clearly what I'm trying to say. Just gonna explain it I don't know, in a way, in an easier way, like it's something, it's written, it's abnormal, so we have to make another exams to get to the disease or something like that. It's
Okay, to catch what's going on, why it's going wrong, right?
yeah.
An easy way to call a relative when you have to give this hard explanation that you must stay. Would say that you are on risk and you certainly need more studies, more investigation to find what is going on with you, right? Non-technical words, you know about it. Through the time with practice, we catch the best way to say it, but a good way could be to tell her not using medical terminology or what kind of studies, because when a patient hears that something is wrong with the electrocardiogram, they run mad. They say, why me? Something is going bad. My heart is going to stop. What's going on? Just tell him you have to stay, and we certainly need more investigation. That's all. And I'm here with you. That's the best expression to calm down the patient. During the module 2, we are going to talk more about pathologies, readings, making the interpretation about lab tests, imaging tests, X-ray, CT scan, I mean, and that kind of activities. Of course, we are going to check the statistics too. So any doubt you got, Dorian, please, without any trouble, ask about it, because you are still a student and you certainly need a basis. But don't worry about it. We can work on this together, okay?
Okay.
Okay, same for you, Laura. Any question? There's no trouble on this. We can solve it. That's the objective of the pool of the workshop, not the pool of the workshop, to solve doubts, to catch more expressions, to make it properly. Okay. Tomorrow.
Yes, teacher, thank you.
Okay, tomorrow we have the second class of this module 2. So please check the presentation of yesterday, because it is actually the basis for the class of tomorrow, okay? Okay.
Okay.
Okay, great. So see you tomorrow, Laura and Dorian. Bye-bye.
Bye, teacher.
Bye, see you. Good night, Laura. Laura? Yoo-hoo, Laura Jawita. Can you hear me now? Laura. I don't like.
Sorry, teacher, I had problems with my microphone. Good night.
Okay, good night. Yes, I just received your messages. I'm sorry.
Yes, sorry, teacher.
No, don't worry about it. I understand. It usually happens. Let me see, Laura. At this point, you are a general practitioner, right?
Yes.
Great. So it's easy to work with you tonight. During module 2, all workshops are going to be similar to this one. I'm going to show you a specific kind of information, and you give me your interpretation, not for evaluating medical knowledge. It's not objective. It's just to evaluate the expressions you use, okay? Let's start. Can you watch my screen?
Yes, now yes, teacher.
Yes, we have a monitor, right?
Yes.
Okay, imagine you are the doctor on duty. You receive a patient in bad conditions and you got these readings. And well, you are on duty, but the specialist is coming and is asking for you to give him the values and your interpretation. How you might talk about this?
Maybe we can say that the cardiac frequency is high.
Okay, the heart rate, right?
Yes, yes, sorry.
Is high. Okay, how much is high? That's a question of the specialist, I tell you, because every time they say the same. They don't know anything different.
Yes.
How you might use this explanation?
How many is high, teacher?
Yes, how high is high? Yeah.
Is 30, I don't know how to say it in English. Frecuencia, latidos por minuto.
You get this. Yesterday we were talking about it. Beats per minute.
Yes.
Yes.
Is 30 beats per minute height.
Okay, 130 beats per minute, okay?
Yes.
Perfect, but following these readings, this rhythm is varying. It's higher than 130 beats per minute and it's varying, it's not constant, right?
Yes.
What about the BP? What would you tell them? It
The
looks,
peer.
okay, what would you say about it, about the red numbers?
Okay. The pressure heart is okay. And the peer, I think, is high. I can see it, teacher. Now yes. It's
Okay,
high also.
okay, the systolic and diastolic values are under normal parameters, right?
Yes.
At this point, but if we make in contrast with this, what would you say about this patient? It's a critical patient, it's an taking care patient. Well,
I think it's a critical patient.
Yes, we certainly need more data, right? Because this
The
trace,
electrocardiogram.
yes, this
Yes.
reading is showing us a specific situation, right?
Yes, maybe a fibrillation.
Yes.
Mm.
And this patient is getting into a cardiac arrest.
Yes.
That's why it's going wrong. I'm sorry, poor guy. Yes, could be. Let's cross fingers and it opens. It's not opening. Well, patience. Can you watch the one that I'm pointing now? The small one.
Yes, teacher.
Oh, it's not so clear. Okay,
Now
well,
yes.
okay.
Now
What
I
do
can
you
see.
say about it? It changes. No, let me look for another one. Maybe this. Is it similar?
I
My,
think it's okay.
are you sure? What about the readings
The
of the
oxy,
electrocardiogram?
no, is
It has a very huge, a very high T wave, right?
yes.
Yes, could be.
Yes, could be.
But this patient is receiving oxygen supply because, well, that's the reason it's with 100%. It's so high. It's not a good objective to get it in 100, but his doctor decisions. What about this one? How you can explain to you, maybe, well, you get into the emergency room with one of your relatives, who knows, with someone that trusts on you, The patient gets into the evaluation, you are outdoors. But when doctors finish their job, they call you and show you these readings. They don't know you're a doctor. And they tell you that your patient, your relative, has to be admitted. They talk to your relative, but he's so scared and is denying the situation, but they are asking for you to explain your relative that he has to stay into the hospital. How you might give this explanation?
Mm, maybe I could say that the electrocardiogram is not in the right way,
Okay.
and also the heart pressure, the systolic one, also it's high than the normal parameters,
Okay.
a little high.
Okay. Give me a second. Okay. And well, doctor comes and hears you and asks for you. Oh, you're checking the readings, and because the way you talk, I think you're a doctor, right? And you said, yes, I'm a doctor too. We are colleagues. What do you understand from these readings?
I'm not sure, teacher, but I think it's fibrillation also.
Yes, an atrial fibrillation. It looks like that because it's not so clear.
Yes.
But following this, you can check. We got the values, and it's abbreviations, right? Because we have to focus on making the small values, maybe small ways to write down in a properly way, right? And monitors always have these meanings, the BPM, beats per minute, or if we talk about the respiratory rate, we use the same abbreviation, but it's breaths per minute. Do you remember that difference from yesterday class? We were checking that they were the same, but of course, according to the context, we know which one we are talking about.
Yes, teacher.
Okay. Yesterday, well, we also were checking the parts and the values of the American heart rate. Here you got this, the BPM. Beats per minute, talking about the heart rate, the abbreviation, the pulse, the abbreviation of this. I forgot to write it down, but it's P, it's just a P. Both of them, heart rate, HR or P, are talking about the pulse, the heart rate, in order to catch that when we get the value, we don't use heart rate, we use BPM. For example, 75 BPM, or like this, 130 BPM, right? Or just a P. In different monitors, you can check BPM, you can check P, or if it's in Spanish, well, we know. If, for example, this, I think it was different because I was checking, it's not letting me. Well, it's not possible to watch now because my internet connection is failing a little bit. Then we got the respiratory rate, the double R. Again, we got the way to show this information again. BPM, breaths per minute. So just for getting in this idea, for memorizing that both abbreviations are the same. About the temperature, well, you know, we were checking these places to take the temperature properly. Usually monitors have a temperature too, but in these situations that I found, we are not evaluating this. But it works, okay? Any question until this point?
No, teacher. Well, maybe one thing. When you have a patient with a blood pressure high, like, I don't know, 130, 90.
Yeah.
We should say how high is the blood pressure, something like that. Hypertension, grade 1 or grade 2 or something like that, or it's not necessary.
Well, grades are for us, for doctors to get the correct classification and get the correct treatment, right? That's the objective of the
Yes.
classification as a general idea. When we receive a patient like that, we have two options. We can say the value if you consider that the patient may understand and stand this information, and it is not gonna be a stress factor. Or you can just say you have, at this point, you are with high BP, with high blood pressure, and we certainly only need to get it under control. That's all, it's your choice. It's not an unloyal situation to avoid giving the value, but it could be properly if you consider that the patient is not going to be under more stress and get more high BP, okay, you can give the value. Or maybe if the patient is asking for that, but if you consider it could be important, do it. Okay.
Okay, teacher. Okay, thank you.
Yes, same as in Spanish. While talking to the patient, you are not in the obligation to give that value. When you talk to the relatives, to the one that is getting as a company to the patient, that is belonging him, well, then you have to give the value for understanding and catching the correct situation, because a loyal purpose, same to Spanish in that situation, okay?
Okay, teacher.
Okay, I send you the poll to take attendance.
I will check it, teacher.
Okay.
I can see it, teacher.
Okay, let me send it again to take attendance. Okay, can you watch it now?
Yes,
Great.
teacher, I feel it.
Great, Laura, thank you.
Thank you very much, teacher.
In module 2, workshops are going to be similar to this one. I'm going to give you a specific topic, and we are going to talk about it. The way to give the correct information, to give the correct expression, okay? Don't worry about diagnosis or things like that, but we are going to practice how to explain treatment, how to explain X-rays, imaging tests for you as a doctor and for giving information to patients, okay? That's why we are going to talk a lot, yeah. Moreover, we are going to practice again, writing down the physical exam, the way to give the report of lab tests and imaging tests. And well, I think it's going to be with enough time to do it, okay? Tomorrow, we have the second class of module 2. Please check the slides of yesterday because they are the basis for working tomorrow, okay? This basis is going to help you to catch properly the topics of tomorrow, okay?
Okay, teacher.
Okay, Laura, that's also everything I prepared for tonight was that. Thank you.
Okay,
Thank you
teacher.
for being always on time. I really appreciate that.
No, teacher, it's okay. Thank you very much.
Okay, you're welcome. See you tomorrow, Laura.
See you tomorrow, teacher. Bye-bye.
Bye-bye. Okay, everything is done. Time's up, so I'm gonna close this. Bye-bye.